My name is Diane. I work at the Lung Health Foundation, lunghealth.ca. You can reach us Monday to Friday during business hours or leave a message after hours. You can reach us through email. You can reach us through the website. You can reach us through the telephone or chat line. Today I'm going to take you through the self-assessment test on the Ontario government website for COVID-19. And I'm going to go through a couple of scenarios just to show you that it's a very simple test. You can do it as many times as you like. There's no right or wrong answer, and that it helps you to decide what to do next if you are concerned that you have any symptoms of COVID-19. So everybody, we're going to go through the COVID-19 self-assessment now. And you can see on my screen what the website address is. It's covid19ontario.ca. But if you don't remember that, all you have to do is put in COVID-19 Ontario and you'll get to this screen that I'm going to be showing you. So just as an example to make things clearer and to help you to make sure that you feel comfortable filling it in, we're going to go through a pretend scenario. And I'm going to start the self-assessment test. So I'm going to click on this blue button that's in the middle of the screen. And then it comes up, the next page comes up with a series of questions. And I'm going to choose whether or not I have any of those symptoms, yes or no. So what it asks me is, are you experiencing any of the following symptoms? Severe difficulty breathing, severe chest pain, feeling confused, losing consciousness. I'm going to say yes, and I want to see what the next screen it brings up. So the next screen tells me right away, call 911 or go directly to your nearest emergency department. So that is very clear. If you have answered any of those questions in the positive, it's telling you right away to contact 911 or go to the emergency department. But now let's go back to that again, and I'm going to start again with the start self-assessment test. And again, there's no right or wrong answer. This is for you to feel comfortable with being able to monitor yourself and to know what next steps you should take. So I'm going to say no to this one this time. And what brings up on the screen is another series of detailed questions, just to see where you might end up. So the questions here is, are you experiencing any of the following symptoms? Choose any or all that apply. It asks fever, chills, cough that's new or worsening, barking cough, shortness of breath, sore throat, difficulty swallowing, hoarse voice, runny nose, stuffy or congested nose, lost sense of taste or smell, headache, digestive issues, fatigue, falling down more than usual. For young children and infants, sluggishness or lack of appetite, or none of the above. So I'm going to choose fever. Just as an example, I'm going to choose fever. I'm going to say cough that's new or worsening, and I'm going to click on shortness of breath. Those are the three that I'm choosing right now. And I'm going to go to where it says continue. And it asks me again whether or not there's some more questions here. So have you worked as a caregiver, personal support worker, or other healthcare in any other healthcare setting in the last 14 days? And this includes examples: volunteering in a health care setting, supporting people in their homes, providing care to family members, working in hospitals, long-term care facilities, or retirement homes, or first responders. So I'm going to say no to that. Then it asks me again, do I live in a rural, remote, isolated, or indigenous community? And the examples would be communities in the countryside, outside a town of less than 1,000 people. If you have a 0 as the second character in your postal code, communities accessed by boat or winter roads or reserves. So I'm going to say no. And then again, it asks me some more questions. Do any of the following apply to you? I'm 65 years of age and older. I have a condition that affects my immune system, such as HIV, AIDS, lupus, or any other autoimmune disorder. I have a chronic health condition, such as diabetes, emphysema, asthma, heart condition, I'm getting treatment that affects my immune system, such as chemotherapy, corticosteroids, and TNF inhibitors. So I'm going to say yes to this one. And what it comes up is contact a doctor or Telehealth Ontario. You may be eligible for a COVID-19 test. Do not leave your home. Do not go into a hospital or clinic. So this is very important to understand because, you know, the healthcare officials, they don't want people to just go to a hospital or an emergency department without specifically going through this self-assessment test and knowing specifically that that's what they should do. Because you're trying to really protect yourself, you're trying to self-isolate as much as possible. And if it's not that severe, you may want to just stay at home according to the instructions. So what it says is contact a doctor, Telehealth Ontario. It says do not leave your home, do not go into a hospital or clinic. And it gives you instructions. First, contact either your healthcare provider over the phone or online, or you can contact telehealth, and there's a number, 1-866-797-0000 to speak with a registered nurse. They will tell you what to do next. So just to leave, you know, there's another series of things that are instructed on this page. I'm going to leave that for now because I think that you can read it through yourself and you can decide whether or not it would be appropriate for you. But there's a number of instructions here that can be very helpful to you. I hope that's helpful. And you know, if you need any help, you can always call lunghealth.ca or contact lunghealth.ca. We are here Monday to Friday during business hours. You can always leave a message, or you can send an email, or you can leave a chat. You can chat with us Monday to Friday, 8:30 to 4:30 p.m.